all the patients that we see in a fertility clinic experience very high levels of stress. And when we do questionnaires and we test them, in fact, they consistently score very high. So there is a very, very strong connection with stress and infertility. My initial response is that in most cases, the stress is the reaction to the infertility. You've been trying for a long time. It creates a lot of pressure and tension. And generally, the stress is not the cause of the problem. So it doesn't create infertility. Now, having said this, there is a particular case study that's very common that we see in practice, where someone can literally block their periods because of high levels of stress. So it doesn't happen just because of the stress. It's generally someone who has a particular type of personality that's very restrictive and controlling. They exercise a lot and they don't eat enough. And when you have this kind of perfect storm of calorie restriction, very high levels of stress and physical activity, literally you stop your periods. The best example of this is someone who is preparing for a marathon. So we know that in that case, the brain and stress participates to the infertility. So that's the extreme. Yeah? And in the middle, there is some growing evidence that maybe there are some situations of unexplained infertility that may be related to psychological factors. And in that respect, it's possible that if you try to work on your levels of stress with strategies like, for instance, mindfulness, you're able to reverse to a certain degree that element. But that's the field of a lot of research.